I have the great honor to introduce two leaders in federal government. We're really starting to lean in now to the policy portion of our lineup for today. And today we're going to hear from two leaders from the Federal Task Force on Maternal Mental Health. This too is an important moment for us, just like the last speaker presented research that we've been long waiting for the field of maternal mental health. Recognizing the complexity in maternal mental health, the many federal agencies and cross-sector players that must be involved in solving the maternal mental health crisis, the Policy Center for Maternal Mental Health, our organization, actually wrote the legislation to create the task force that we'll hear from today and worked tirelessly for the passage of the legislation requiring the formation of this task force. The bill was supported by Democrats and Republicans alike and signed into law in 2022. It's my true pleasure to introduce two women who are working incredibly hard, I see it firsthand, to develop a national strategic plan for maternal mental health and also a report to Congress. Ms. Madonna Green, a public health advisor with the Substance Use and Mental Health Services Administration, SAMHSA, and Dr. Centrise Bellamy, a psychologist and senior public health advisor with the Office of Women's Health, are here to give us some updates today. Welcome to both of you. We're so glad you're here. And we'll go ahead and pull up your PowerPoint and turn it over to you.
Great. Thank you for that introduction. Really appreciate that. Hello, everyone, and hope you all are doing well today. I'm going to share some information about our task force on maternal mental health. It was started last September 2023. We kicked it off. And as I'm a representative of SAMHSA and my colleague, Dr. Bellamy, is with the Office of the Assistant Secretary of Health, these two agencies are the co-chairs for the task force. And we're using SAMHSA's Advisory Committee on Women's Services to implement the task force as a subcommittee. The task force is to identify and evaluate and make, you can go to the next slide. The task force is to identify and evaluate and make recommendations to coordinate and improve federal activities related to addressing maternal mental health conditions and co-occurring substance use disorder. The task force, which includes over 100 individuals, both federal staff and non-federal individuals, we're working to prepare and report to Congress, as was just mentioned, and that analyzes and evaluates the state of maternal mental health programs at the federal level and identifies best practices. Additionally, we are developing a national strategy, as was mentioned, for maternal mental health. And the task force is currently, as we speak, working on both of those reports. We were also asked to solicit public comments from stakeholders for the report as well to inform the national strategy. And so we published that in January and it closed on February 9th, where we received the public input and we got over 80 responses, which we were very, very excited about. The task force will also develop reports that'll go to governors during the task force's time. And the task force is set to sunset September 30th in 2027. So we have more time to work on updates to the report to Congress and updates to the national strategy. And I'll transition now to Dr. Bellamy to tell you more about the structure and the focus areas of the task force.
Thank you, Madonna, and hello, everyone. Next slide, please. As Madonna shared in a previous slide, the task force is formed through an advisory committee for women's services with the Substance Abuse and Mental Health Services Administration. Members of the task force were recruited through 2 federal register notices and comprised of over 100 federal and non-federal members. This also includes those with lived experience. The task force is formed under the Federal Committee Act, also known as a FACA, which governs the operation of the advisory committees and emphasizes public involvement through open meetings and reporting. There are 5 subcommittees formed from the overall task force, each with a focus on the following, as you see on the slide here: data and research and quality improvement, prevention, screening, and diagnoses, evidence-based intervention and treatment, evidence-based community practice, and communications and community engagement. Next slide, please. The task force will highlight recommendations that fall within the pregnancy and postpartum periods for individuals with or at risk for mental health and substance use conditions. Based on the omnibus language, the focus areas of the task force mirror those the subcommittees are formed, noted in the previous slide. And the cross-cutting principles are access and equity, trauma-informed, culturally relevant, and federal collaboration, with the goal of increasing all aspects of the maternal mental health access and care while seeking to improve planning, coordination, and collaboration across federal agencies. Next slide, please. The task force on the maternal mental health continues to develop the national strategy and report to Congress, as Madonna noted earlier, and we have 2 meetings next month to begin finalizing both documents, with the plan to finalize early this spring. We appreciate your dedication and interest in improving maternal mental health in the United States, and thank you for the opportunity to share information on the work of the dedicated and impactful task force on maternal mental health with you today. Thank you very much, and I'll now turn it back over to Joy.
Great. Thank you too so much, not only for being with us today to give an update. We're all very excited about what might be coming soon in May and beyond from the task force. And thank you again to both of you for your tireless efforts to make sure all of the work is pulled together timely and thoroughly. And we know it's a huge undertaking and are very excited about what's to come.